Today we have Nancy Farnam from the Varnum law firm. She will be giving you information about the Affordable Care Act and help answer some of your questions as an employer group. Nancy is a partner at Varnum Law. She has over 20 years experience working with a variety of employers in relationship to employee benefit plans. She focuses her practice on helping employers stay current with the laws that impact the welfare benefits of employers' employees. These would include COBRA, HIPAA, ERISA, and IRS code, and most recently, the Affordable Care Act. She regularly presents to employer groups, and what Nancy does is she helps translate the technical terms of employee benefit laws into practical, easy, and understandable terms so that as employers you can assist with your benefits and help your employees. So thank you very much, Nancy. Welcome.
Thank you. Good morning. Also, my partner Kim Clark is here today, so she maybe will jump in and answer some questions as well. I'm going to be talking about the Affordable Care Act today and really focusing on key provisions that are effective right around the corner and some things that are effective over the next several months. There's lots going on right now under the Affordable Care Act, so we will be focusing mostly on these provisions that are coming up soon. First, I'm going to give kind of a broad overview of what the Affordable Care Act does, where we're at kind of now and where we're going to be at in a couple of years, and then I'm going to focus in on those key issues that are relevant right now. When I present, I really like it when people jump in and ask questions. It keeps it a little more interesting, so I'm not just up here talking the whole time, so please feel free to interrupt at any point and ask your questions. So the first thing, what is the Affordable Care Act? This law came into effect in 2010, and basically the goal of the law is to make sure that most Americans have health insurance. And it's not just that most Americans have health insurance, it's that insurance is going to be good coverage, and the way they're doing that, or the way the law does that, is it makes sure that health insurance policies and plans that are provided by employers provide certain levels of coverage. Under that kind of broad spectrum, there are 10 essential benefits that most plans have to cover. And those things are generally things that have been covered by health plans in the past, like hospitalization and mental health coverage and prescription drug coverage. Probably the new one that's kind of a bigger change is preventive care. Beginning in 2014, most plans are going to be required to cover preventive care with no cost sharing. That means that anybody who goes to the doctor for a physical doesn't have to pay a copay. They're not subject to any limits on that physical and certain tests associated with the physical. A big thing that's come under the preventive care is coverage for contraceptive drugs, and that's going to be a new coverage required under plans beginning in 2014. Another thing is that all plans beginning in 2014 are going to have limits on cost sharing. So when an employee goes to the doctor or has other medical treatments, or an individual has coverage, they're only going to be required to pay so much out of pocket per year. That's going to be limited by law. So you're no longer going to have plans where people are paying huge dollars amounts out of pocket. Another thing that's required under the Affordable Care Act is that people actually can purchase coverage. So the law says that coverage has to be affordable, and the law defines what that means. If you're an employer and you're providing coverage, actually a large employer, which is 50 or more employees for this purpose, there's a limit on what you can charge your employees for coverage, and that's typically 9.5% of the employee's income. Also, if somebody is going to purchase coverage on the marketplace, and we'll talk a little bit about that in a while, there's limits on what the different plans in the marketplace can charge an individual. Finally, if people go to purchase coverage on the marketplace and I'll say lower wage income workers, but when you say the limits, I don't really consider that lower wage. But there is government assistance available to help people purchase coverage on the exchange as well, or on the marketplace. And finally, this law makes sure that the coverage that people get is actually meaningful to the individuals. So for example, in 2014, health insurance plans and group health plans offered by employers can no longer have any pre-existing condition exclusions. So if somebody has a pre-existing condition, they'll now be able to get coverage for that, where in the past they might not have been able to. Also, there is a total elimination of limits on dollar limits for benefits. So many plans in the past only covered benefits, for example, up to $1 million or $2 million. So if somebody was really sick and incurred a lot of medical expenses, there was a dollar limit on those costs. Those limits are all going away now. You can no longer have a lifetime limit, and annual limits on many benefits are also being eliminated in 2014. Yes?
I know, like right now, you can have 75-25 share between the employer and the employee.
So 9.5% of W-2 wages from you as the employer. Yes?
Can I back right up to the definition of employee? Is that a full-time equivalent? Full-time equivalent?
Okay, well, unfortunately, the Affordable Care Act has different definitions all over the board. When you're looking at whether or not an employer is subject to the requirement to provide coverage to their full-time employees, you do include full-time equivalents. When you are looking at which employees you actually have to provide coverage to, you're only looking at your full-time employees. We're not going to talk so much about the requirement for a larger employer to provide coverage takes effect in 2015. That's been delayed for a year. If we have time at the end, we'll talk about that. We're really focusing on things that are coming up right around, in the next several months. But we can get into that towards the end of the presentation if there's time. But again, larger employers, and that's employers that have 50 or more employees, and that's where you're counting your full-time equivalent employees, have to start providing coverage in 2015 or possibly be subject to a penalty. And for that purpose, your full-time employees are employees who are working 30 or more hours per week.
Can I just, and I know you're going to cover that at the end, but I can't stay for the whole thing.
Okay.
But there's been some confusion, and I think I know the answer, but I'm hoping you tell me something different. What about temp employees?
And Nancy, can you repeat the question?
Yes.
The microphone's going on the...
Yeah. The question is, what do you do about temp employees when 2015 rolls around and employers have to provide coverage? Right now, we have some proposed guidance. It's not finalized. What that proposed guidance says is that as an employer, you're required to count all of your employees' hours to see whether or not they're working 30 hours per week, and so therefore they would be entitled to coverage. Temporary employees are actually included in that. So if you have temporary employees who typically work 30 or more hours per week, you may have to provide them coverage. The proposed guidance right now allows you to do a look-back period of up to 12 months to see whether or not they were working over 30 hours during the past 12 months, and if they were, then you provide coverage going forward. But the general rule is, yes, temporary employees, if they're working over 30 hours per week, do have to be offered coverage.
Nancy, that wasn't the answer.
Another thing, as far as getting this meaningful coverage, you probably already are aware of this, but older children up to age 26 have to be offered coverage if your plan provides coverage for dependent children. In the past, if you had what's known as a grandfathered plan, you did not have to offer coverage to older kids who were employed and had coverage through their old employer. That goes away in 2014. So now if you have a group health plan for your employees and you offer dependent coverage, that coverage has to be offered to all your employees' kids up to age 26. And just as a side note there, you can charge the employee 100% for that dependent coverage. There's no requirement for the employer to pay any portion of the premium for the dependent children. So how are we going to reach this goal of making sure that everybody gets this meaningful coverage? There's roles for all sorts of different people. Individuals have roles under this law. Employers have roles under the law. Insurers have new requirements under the law, and the government will also participate in making sure that everybody gets this coverage. The individual, as far as their responsibility, starting in 2014, almost everybody's going to be required to have health insurance coverage, and we'll talk about that a little bit more in a little bit, about who's exempted from that rule and what exactly that means. But as an individual, if you don't have coverage, you're going to be paying a penalty starting in 2014. Individuals will be able to get coverage in a number of different ways. It could still be through an employer-sponsored plan. If a person qualifies for Medicaid or Medicare, those rules will still be around and they'll still be able to get coverage through Medicaid or Medicare. They'll still be able to go out and purchase coverage on the individual market. And we'll be talking a little bit about that, I think, towards the end here. And finally, there's these new things called marketplaces or state exchanges. And under those programs, every state's going to have kind of like a one-stop shop place where you can go and look at different coverage or insurance options throughout the state and compare prices and compare coverages and purchase your coverage through that marketplace. Employers also have a number of responsibilities. A lot of this law falls on the shoulders of employers. If you are considered a small employer, and that is under 50 employees, you're not required to provide any health insurance coverage to your employees at all. That is not changing under this Affordable Care Act. If you do decide to provide coverage for your employees and you're really small, you might get a tax credit, and we'll talk about those requirements in a bit as well. Again, as we talked about a little bit in 2015, large employers, and for this purpose that's somebody with 50 or more employees, aren't going to be required to provide coverage, but they might pay a penalty if they don't. And there's a couple instances where a penalty may kick in. If, as a large employer, you decide not to provide coverage at all, there is a penalty. If you decide to provide coverage but it doesn't meet these certain requirements, it's not affordable, as we talked about, that 9.5% of income is what the employee is paying, or it doesn't provide what's called minimum value, you might also pay a penalty. That minimum value test is kind of complicated, and that's something that you can ask your broker about. Your broker will be able to tell you, should be able to tell you whether or not your coverage is considered minimum value coverage. Also, any plan, if you're an employer and you're providing coverage to your employees, you have to meet certain requirements. And we've just talked about some of that. Out-of-pocket maximums are limited. You have to provide essential health care benefits, that list of benefits that have to be in different policies, and we'll talk about that a little bit more. But that's how employers will participate in this law. Finally, insurance companies are subject to a number of reforms intended to make coverage more available to people and also more affordable. Beginning in 2014, they can't deny anybody who applies for coverage. So in the past, if you were sick or if you were an employer and didn't meet certain requirements, they didn't have to offer the coverage to you. Beginning in 2014, they can't deny coverage to anybody that applies. They also can't discriminate based on health status, so they're not going to be able to charge a higher premium to people who are sick, which they can do now. If an insurance company is raising rates, those rate increases actually have to go before the state insurance board, I guess, and be reviewed to make sure that they're reasonable rate increases. Also, insurance companies are going to be limited in their ability to vary rates. So right now, rates can be all over the board. Beginning in 2014, there's very limited restrictions on how rates can be varied. They can vary rates based on different age bands, so older people might be paying more for a policy. They can vary rates based on geographics area where a person is living, and they can vary rates based on smoker status, but smoker status is the only health factor that can be considered when varying health insurance rates. And then again, the health insurance policy beginning in 2014 have to include the essential health benefit list, so there'll be a minimum level of benefits in all the plans that are offered through the insurance market, and cost sharing will be limited under those plans as well. And then the government's participation, they're going to be, the state and federal local governments are going to be sponsoring these marketplaces, and they are going to be offering, they'll be in charge of responsible for offering this financial assistance that we'll talk about to people who cannot afford coverage. So that's, everybody's participating in this, getting coverage for all, and it's very confusing. So, like I said earlier, today what we're going to discuss is what you need to be doing right now. There's something coming up right next week that you need to be worried about or thinking about, and then in a few months, over the next few months, you've got some things you should be thinking about to prepare for 2014. The big one coming up, October 1, there is a new notice that's required, and as an employer, no later than October 1, you are required to notify all of your employees about the existence of this state marketplace or state exchange. So this notice will tell people, you know, there's this new marketplace where you're going to be able to look at different coverage options and compare options, and you may be able to purchase coverage. And the government has put the responsibility on employers to notify employees about this rule. Yes?
Is that just for employers that don't offer a plan?
This is for all employers that are subject to the Fair Labor Standards Act, and I will get Kim's input on this, but I believe probably all of you are subject to the Fair Labor Standards Act. Yes. So this applies to all employers.
So you already offer group coverage, why would they want to purchase individual coverage?
The question is, if they already have group coverage, why would they want to purchase individual coverage? That's a great question. They probably won't. But that doesn't, you still are required under this law to provide the notice.
So even, Nancy, if you have one employee, you still need to do this?
Even if you have one employee, you still need to do this. There's no limitation on the number of employees you have. Again, the notice, if you have anybody who's a current employee right now or as of October 1st, gets the notice. It doesn't matter if you provide them coverage or not. It doesn't matter if they're part-time or full-time. Anybody who's an employee as of October 1st gets this notice. After October 1st, you're required to give the notice within 14 days of date of hire. So anybody who's employed after October 1st also gets the notice within 14 days of hire.
Nancy, I
Yes.
want to go back to the Fair Labor Standards Act definition and just ask, is there, I mean, I heard you say all employers, but where would be the limit? Is there an example of somebody that would not be included, that would not be required to provide?
I'll have Kim help on this one.
Right, that's a good question. And Fair Labor Standards Act, the reason I said yes to all is because when you do interstate commerce, when you're involved in interstate commerce, you're subject to the Fair Labor Standards Act. And so essentially everyone in the room, I think that as a practical matter, Department of Labor has assessed that everyone in agriculture, even small farms, are somehow engaged in interstate commerce and therefore subject to the act. So as a practical matter, I think that the best course of action is to comply.
Last week, did that answer your question? Yeah.
Yes.
Last week, the Department of Labor put out this little question and answer that says, the question was, are employers subject to a penalty for not providing this notice? And the Department of Labor's answer was no, they're not. We're confirming that under the law, there's no penalty for not providing the notice. However, they did not say that doesn't mean you don't have to provide the notice. So the rule is still out there that you have to provide the notice. If you don't provide the notice, there's no penalty under the Affordable Care Act. My advice is to provide the notice, even though you're not going to have a penalty for not doing it, but I think that it makes sense to provide the notice. And things that I'm reading, just comments on, the different sites I subscribe to regarding employee benefits, is that the Department of Labor has informally confirmed that even though we're saying there's no penalty, you still have to give the notice. So again, who gets the notice? All of your current full-time and part-time employees. So anybody that you employ right now will get the notice. And Kim and I were talking a little bit before this. Example, if you have seasonal employees who are still considered your employees, you'd give those employees the notice. If the seasonal employees are gone and they've been terminated and then you'll rehire them back at a later date, you don't have to give them the notice October 1st, but then when they're rehired, you would give them the notice within 14 days of when they come back to work. Workers hired through a contractor. Some of the rules on hiring employees through a third party when you're looking at employee benefits are a little bit ambiguous. For purposes of most employee benefit rules, the IRS and the Department of Labor treats the company that the employee is actually going to work at every day as the employer, even though somebody else may be paying that person. So to be safe, I would suggest that even if you're hiring somebody through a temporary agency or through a third party, that you provide them the notice as well. Any questions on who gets the notice? The notice has to be in writing and has to include these 3 key things, and mostly it's just advising people that there is this new marketplace and who they should contact to get more information. This next thing is just about the minimum value question. You know, does your plan provide minimum value? And that's the one I said you suggested that you go talk to your broker about. They'll be able to help you answer that question. And finally, you're supposed to explain through this notice that if the employee goes to the marketplace and gets coverage, they're not going to get the employer-sponsored coverage, and the employer is not going to be paying for the coverage through the marketplace. Michigan Farm Bureau has prepared a notice, and it's on their website. It's a model notice that you can use. I didn't put a website in here, but everybody has.
Yes, the same website that they went to access
Okay.
information on healthcare. We'll put the DOL model notice, and then we'll also have ours up there.
Okay, so on the same website that you access this webcast will be the notice. And there's some information you'll see when you go to that form that you need to complete. And I've put the answers down here the best that I could, but our marketplace in Michigan is the Michigan Health Insurance Marketplace. The contact is that website I have there. That's where people can the website they can go for more information. And then again, the minimum value question, your broker can assist you with that. There are rules that sometimes allow you to send out notices electronically, but for this purpose, paper copy is best. If you want information on electric copies and when you can do it, I can give that to you, but I suggest paper copy for your employees. The Department of Labor also has issued some model notices, and they've issued notices for employers that provide coverage and one for employers that do not provide coverage. They also have the notices available in Spanish. I will tell you that the Department of Labor notices, which are also available on Michigan Farm Bureau's website, are a bit wordy. They have more information in there than you need. You can certainly use them, but like I said, there's more information in there than you need, so you might want to rely or use the Michigan Farm Bureau's notice or another notice you may receive. Yes?
When you provide this notice, are you telling your employees whether you will provide them health insurance or not? And then if you are providing health insurance, do you need to offer them that plan prior to that October 1?
The question is, in this notice, do you have to tell employees that whether or not you as an employer provide coverage? And if you tell them that you do you have to offer it prior to October 1? In the notice, you do say whether or not you provide coverage to your employees. Although, let me see here. It's interesting, when you look at the 3 items that are required, it doesn't say whether or not you have to say that we provide coverage, but you have to say whether or not your coverage meets the minimum value test. So I think that probably you do need to tell your employees whether or not you provide coverage, because that kind of is implicit in telling them whether or not your coverage meets the minimum value test. I don't think that coverage actually needs to be in place today. I think it has to be in place January 1st when they can purchase coverage on the exchange, because you're advising them of what your situation is. But if you don't have something in place today and you're saying that we'll have something in place January 1st, you just have to make sure that you actually do that. You don't want to put something in the notice that isn't true or isn't accurate and may change down the road. Yes?
Do we need to tell them the minimum value at the beginning of October or the beginning of January?
The question is, do you have to tell them? I'm not trying to laugh at your question, but there's so many unanswered questions under the Affordable Care Act. The question is, do you have to tell them whether or not the plan provides a minimum value as of October 1st, as or of January 1st? And I would say that is not a question that's answered in the law, but I think as you're preparing your notice right now, you will tell them what your coverage is right now, whether or not it provides minimum value, because you don't have your coverage in place right now for January 1st, and although it probably will still be minimum value on January 1st, that may change. So I would say whatever your coverage is right now. Yes?
Nancy, I know in the notice that you have to put the exchange website. That's not even up and running yet, is it?
Yeah, I have a little quote here later on in the materials. The question is, you have to put information about the exchange into the notice, and that's not even up and running yet. Where you go for information is that healthgov.com website, and then you pull down your state. And like I said, I have a quote later in the materials. Right now, when you pull down Michigan, it says nothing's available till October 1st. So you can get no information right now about Michigan's exchange. And I read a lot about this stuff, and I have seen nothing about Michigan's exchange.
So when you have 1,000 employees and they go on that site, they're going to be calling the HR department and saying, hey, there's nothing on that site.
The question is, the employees are going to call you and say, you referred me to this site and there's nothing there. You don't have to provide the notice till October 1st, so you might want to wait till October 1st. And theoretically, information will be up and running October 1st. That's the promise anyways. That's what it says right now. And actually, I've been on the site a lot the past couple weeks, and although you can't get to Michigan's site, so we don't know what the plans are going to look like in Michigan, it's a pretty easy to navigate site, and it actually has some good information. Any questions on the notice?
Just one, hopefully just one. The electronic, an electronic copy, can that be, ordinarily you can provide a link, a notice that says, click this link and you can get a paper copy, or you can include a statement that says, if you would like a paper copy, we will provide one free of charge. Is that still, that's still okay? You had said there may be caveats to it.
There are questions on electronic notice, and the rules right now on electronic notification are generally if all of your employees have access to a computer as part of their job, so they're part of their job, they're accessing a computer, you can send the notice to them electronically, or you could send them an email that says attached is the notice. Again, that's for your employees that have access to a computer for part of their job. If they don't have access to a computer as part of their job, you have to get electronic permission from them to provide the notice electronically, which is very difficult to do. So if all your employees have access, or some of your employees have access to a computer as part of their job and you want to provide the notice electronically, that's fine. Okay, so moving on from right now, what you need to be worried about in October 2013. In 2014, a number of these new Affordable Care Act requirements kick in. This law, like I said, was effective in 2010. In over 4-year period, or even more actually, different parts of the law kick in. So in 2014, there's new rules that apply for individuals and for employers as well as for the government. For individuals, as I've already said, starting January 1, 2014, most individuals are going to be required to have coverage, health insurance coverage. And there will be a penalty assessed against the individual for any month that they don't have coverage. There are a number of exemptions for people who don't have to get coverage. All of these exemptions, you have to get permission through a state exchange or a letter from the state exchange that you're exempt. So you can't just say, I religiously object to this and I'm not going to do it. There's more to it than that. You actually have to get a certification from the state exchange to do that. People who are not U.S. citizens or nationals who are not in the country legally, or they're non-resident aliens, they're not permitted to purchase coverage on the exchange, so they're not penalized for not having coverage. People who are in jail don't have to get coverage. There's a rule too, people who don't have any coverage available to them that's affordable don't pay the penalty. And I was trying to think through how this works, because if you don't have employer coverage that's affordable, you can purchase coverage on the exchange and get help paying for that coverage. So there must be like some band of income level where you're not eligible for Medicaid, but and you're also not eligible for premium assistance. So there must be a small group of people who this coverage won't be affordable to. But again, that's something that the state exchange would help the person figure out. Also, if somebody goes for coverage for a period of less than 3 months during the year, they're not going to be penalized for those months in which they don't have coverage. So say, for example, one of your employees, or you, for example, don't have coverage for a limited period of time for 3 months during the year, you will not be subject to a penalty for those 3 months. If you don't make enough money to file an income tax return, you don't have to pay the tax. And then there's a few other exemptions, one of which is just kind of a catch-all, and people can apply to these state marketplaces to be exempted from paying the penalty. Also, a person doesn't pay a penalty if they have what they call minimum essential coverage, and that's government-sponsored plans, Medicaid, Medicare, TRICARE. If a person has employer-sponsored coverage, that's considered coverage, and they don't have to pay a penalty. If they purchase a policy in the individual market or on the marketplace, they're not going to pay a penalty. Well, that's that. So the penalty is a dollar amount based, there's like all sorts of different tests, and I'm not going to run through this test here. If you decide for some reason you don't want to take coverage next year, you can go through these figures and say, yep, that makes sense, I'll pay that penalty and not get coverage. But I have the formula here, as well as an example, and you can kind of run through that again if you're in a situation where you decide that you don't want to take coverage. So just some key things on the penalty if you don't take coverage, or if your spouse doesn't take coverage, or you have dependent kids who aren't covered. Spouses are jointly responsible for each other's penalty. So if you file a joint return and your spouse doesn't have coverage, you're going to be responsible for that as well. Also for your children, if they don't have coverage, you're responsible for that penalty tax, and you will pay that on your tax return. So that's what the individual responsibility is in 2014. Now we're going to look at what employers have to do in 2014. If you have 50 or less full-time employees, is there anybody in here that falls in that category? Okay. You may be, if you do provide coverage to your employees, you may be able to purchase that coverage through the state exchange. And the state exchange for employers is called the Small Business Health Options Program. There's a number of features if you decided to do that. You do it the same way individuals do. You go onto that healthcare.gov website, and there's a pull-down option for small employers, and it walks you through the process of looking at different policies that are available and what they cost. The original goal of this is so that the employer could say to their employees, go out and purchase your coverage on the exchange. I'll pay this much towards your premium, or I'll pay nothing towards your premium. But that was intended to give employees choice and allow employers some affordable options to purchase coverage. Apparently, this is not fully operational. And I think what I've been reading is that there's only one plan available on each state exchange. So for 2014, this probably isn't a great option. But it is something you might want to consider if you do offer your employees coverage. At least go on there and look at what the costs of the options are on the state exchange. Small employers, and this again, I told you the definitions are all over the board. For this purpose, a small employer is somebody that has less than 25 full-time employees, and the employees are earning, on average, $50,000 a year or less. If you purchase coverage through the state exchange in 2014, you probably will be eligible for a tax credit for the premium payments that you paying on that state exchange. So if you fall into that category and are interested, again, that healthcare.gov will walk you through how you apply for the tax credit and how that may help your business. Also under employers, yes?
That tax credit, is it a credit against the taxes you have to pay that's in addition to the expense deduction that you would normally have?
Yeah, the question is it a credit in addition to the expense deduction? And the answer to that is yes. So you have your deduction for the business expense of providing the coverage, as well as a tax credit. Also, as an employer, if you provide health insurance to your employees, starting in 2014, there's a number of new requirements that you'll have under your plan. These requirements are tied to your plan year. Not all plan years coincide with the calendar year, so these might not be effective for you January 1. That's a question, again, if you don't know, your broker will be able to tell you what your plan year is. One of the big changes is that there can no longer be a waiting period of longer than 90 days. So if you offer coverage, coverage can't be effective any later than the 91st day of employment. A lot of plans say things like the first day of the month after 90 days. That doesn't work anymore starting in 2014. It can be no longer than the 91st day of employment as an eligible employee. So if, let me just caveat that. If you don't provide coverage to part-time employees and somebody's working part-time, obviously you don't have to cover them after 90 days because they're not eligible under your plan. Again, there's all sorts of new coverage requirements for employer-sponsored plans. That's the preventive coverage that you have to provide. There's new coverage requirements for clinical trials, different coverage things. All of these things are probably going to increase your premium costs. They're going to make the plans more expensive initially because coverage is being expanded under the plan. Out of pocket, what people pay out of pocket is being limited. So when you're looking at what people are paying in deductibles and co-pays, all of that's limited starting in 2014. Is everybody here insured, or does anybody self-insure benefits? Does everybody purchase an insurance policy? Your broker, your insurance company, all of these things will be built into the policy because the insurance companies are also subject to these rules. So the new coverage requirements will be built into the policy. The 90-day eligibility won't necessarily be built in. That's something that you'll have to build into your practices, but the coverage requirements will be built in. Also, in addition to this new state exchange notice that we talked about that's due October 1, you as an employer have all sorts of new reporting obligations, which you may already be aware of, you may not. But already you should be providing a summary of benefits and coverage to your employees, and that's something that will come from the insurance company. You already are required to report the cost of health insurance on your employees' W-2s. Certain small employers that aren't required to file their W-2 electronically are currently exempt from that rule, but that will kick in at some point. And starting over the next couple years, it was supposed to start in 2014, it's been delayed a little bit, there is going to be all sorts of new reports due to the government. And these reports are going to be advising the government who your employees are, how much money they make, whether or not you provide coverage, what your coverage looks like, does it provide the minimum value, how much does the coverage cost, how much are you paying as an employer. All of this information intended to let the government figure out whether or not you're subject to a penalty as a large employer and whether or not the individual has the coverage that they're required to get. Now, this is one of those things that the government wasn't quite prepared to get all this information and process it and figure out what it means. So this has been delayed. And I think most of these reporting requirements, you'll have to start gathering the information in 2015 and have your reports in for 2016. Yes?
I'm sorry, are we on over 50 employees or under 50 employees?
The reporting to the IRS, and I'm sorry, these rules are all over the board, but those rules are going to apply across the board, I believe. We don't have final guidance on that yet.
So this PowerPoint, this slide is...
This slide right now is everybody.
Okay.
And if the SBC and the W-2 are already in effect, so if you have a group plan for your employees, you're going to receive from that provider an SBC form that you can then forward on to your employees, or will it be sent to them directly?
The SBC requirement, the question is, does the insurance company pay that, or does the insurance company provide that, or does the employer? The insurance company provides it. The responsibility to distribute it falls on both the insurance company and the employer. So you just need to work that out with your insurance company who's going to actually distribute that to the employees.
Can you explain it on what an SBC is?
Yes. What is an SBC? Sorry about that. Summary of benefits and coverage. So if you have a group health plan and you're actually complying with all of the rules that are in effect now, you have to have a summary plan description that describes the terms of your health benefits to your employees. This is a new requirement. It's called a summary of benefits and coverage. It started up, last year was the first year that had to be given to employees. And it's about a 6-page document. And it describes what your coverages are, and it goes through different coverage categories. For example, hospitalization, the plan covers it, and this is how much we pay under the plan. And it goes through a number of different categories of coverage, what the employee is required to pay, what the plan pays, and then gives some coverage examples. The format is mandated by the government, and the goal here is that an employee could get these summary of benefits and coverage from several different providers, from their employer, from someplace on the marketplace, from the individual market, and compare the coverages on a side-by-side basis so they're actually able to make a meaningful comparison.
That's correct. If you have Blue Cross Blue Shield coverage, they have created SBCs for their plans. So you could get that from your agent or from Blue Cross Blue Shield if you need that for your employees.
Yes, if you have Blue Cross Blue Shield or really any other insurance coverage, they will be providing that summary of benefits and coverage for your company. And again, you just have to make sure they're actually distributing it to your employees and not relying on you to do that. And that typically goes out with your annual enrollment period. So if you are a calendar year plan and your benefits renew in January, you'll be wanting to get that out, November, December, before, as people are electing whether or not they want benefits if they have that option. Finally, in 2014, the government responsibilities, they're going to be setting up these state insurance marketplaces, and we've already talked about those. There's the website there that you can refer to for the marketplaces, and here's that quote I promised you earlier. Yes?
I'm sorry, the previous slide said reporting to IRS. What are we reporting?
That's the various forms. We don't have complete guidance on that yet, but that's where you're going to be reporting who your employees are, what they earn from you, whether or not they have coverage from you. There's actually several different reporting requirements, and again, this is the one that's been delayed because the government hasn't quite gotten all the obligations together yet. So you don't have to worry about that in 2014. I guess it shouldn't have been on this slide. That requirement won't begin until 2015.
Isn't a lot of that information on a W-2 form?
A lot of it's on W-2, but there's even more information such as what coverage you provide, how much the employer pays towards the cost of coverage, things like that. So there's additional information that's not on the W-2 that's going to be required.
Nancy, you said that was for all employers, not just 50 or bigger?
The question is that just for all, it was for all employers or 50 or bigger? My understanding right now is that there's 3 or 4 different reporting obligations, and I'm not sure exactly what applies to what employers at this point, so I think that there will be obligations on all employers to report some level of information. Again, that's so the government's going to track whether or not individuals are eligible for premium tax credits and those types of things.
I'm sure they'll let us know what to do in plenty of time, right?
In plenty of time. I usually tell people, as I've started keeping in track of this, I have a stack of regulations. I'm not exaggerating. Probably that high of very small print, so it's a little crazy. Again, okay, so the state insurance marketplaces, here's what I told you was on that healthcare.gov site. Here's what you go to right now. If you punch in Michigan, we'll figure it out, and we'll know on October 1st. So that's unfortunately all I can tell you about Michigan state exchanges. I don't know what they're going to look like, how much coverage is going to cost, what options are going to be available. We'll find out next week. Also, I talked about if people don't have coverage, if they don't have employer-sponsored coverage or Medicare or Medicaid, and they purchase coverage on the exchange, they may be eligible for assistance in purchasing that credit. And that comes in the form of 2 things. One's a premium tax credit, and one is cost-sharing reductions. The general rule is if you work for somebody and your employer offers you coverage that's affordable and meets that minimum value test we've been talking about, they're not ever going to be eligible for a assistance for purchasing coverage on the marketplace. Even if they don't take your coverage and they get it, if they have it available to them, they're not going to get the assistance. So for the tax credit purpose, when people go to fill out their application to purchase coverage through the marketplace or the exchange, is they're calculating the premium cost, that will just be shown as they're applying for the coverage. Those will be automatically built into the application process. And as I said, this is supposed to be intended for lower income people. And this just came off of that healthcare.gov website, and I won't go through all these numbers, but you can see the income range is pretty wide for people who will qualify for some sort of assistance for purchasing coverage on the exchange. There's also these cost sharing reductions in addition to the premium tax credit. And what this means is that when people purchase coverage through the exchange, they will get a plan that has lower deductibles and out-of-pocket costs, but they'll only be paying for a plan that costs less than that more generous plan would typically cost. On the exchange, there's 4 levels of different coverage that's going to be available. So people will be paying for a silver plan, but they're going to get a higher level of coverage if they qualify for these subsidies. And again, this is intended for lower income, and here's kind of the wage range for that assistance. Oh, that's it. There we're at. So, does anybody have questions, or you want to talk about that 2015 stuff, or you want to finish on the...
Just looking at the numbers that exist, there will be a lot of farmers that have variable income from year to year. It depends on what the value of crops are and what expenses there are, and there's a number of factors. How do you determine if you have to purchase something for, let's say in 2014, are you using 2013's income to make those determinations?
The question is, how do you determine income? Are you using 2013 to determine 2014? That is not entirely clear right now from my reading of what's available there. I think the intent is, there's regulations that were just recently issued. It's going to be kind of an estimate, and if you're off at the end of the year, however you're off, it will be fixed through the individual's taxes. So I think you might use 2013, but if you know there's some variables that are in existence in 2014 already, I think you'll be able to use some estimates, but that is not clear right now how that's going to work. Yes?
Nancy, just trying to think how an individual would make a decision here. If they're, and I'm not sure if I'm understanding these numbers right. So if you have a family of 4, what is you're gonna be subsidized $58,000?
No, if you have a family of 4 and you make up to $58,000, then you'll be subsidized.
And how much of that was the subsidy on the previous page?
No, we don't know what the subsidy is.
Wow, we don't know what the subsidy
No, we don't know what the coverage is. We don't know.
So how does an individual, if you're a family of 4 and you don't have, obviously if you have company coverage, you might not worry about any of this. But if you don't have company coverage, what are your decisions right now?
Well, if you have company coverage, most employees will take the company coverage because the company is generally helping pay for part of that premium, and it's that cost is not included in their taxable income. So that's probably always going to be a better deal for those people than purchasing coverage through the exchange. Right now, before 2014, if somebody doesn't have company coverage, they either are on Medicaid because their wages are low enough to qualify for Medicaid. They've purchased an individual policy if they've been able to get one that they can afford, or they go without coverage.
And how would that person be? Well, if you're in that situation, what would you be considering right now? Would you just wait until October 1 and?
Yes, if you're in that situation and you're an individual without coverage right now, or you're paying a lot for a policy, on October 1 or sometime in the next couple months, you'd go on to that website and hopefully it will be operational. And again, I said it's really easy to navigate, and hopefully as they put in this additional information, it will be easy, but you're supposed to be able to plug in what state you live in, and they will pull up the policies that are available on your state's exchange, and you'll be able, be able to compare costs. I don't know, has anybody ever looked through the Medicare Part D when that came up, the prescription drug coverage for Medicare? There is a website where you can compare different plan options. You plug in the drugs that you take and it will pull up the different plans in your area and what they cost. I'm kind of envisioning that this will be similar, but I don't know yet because it's not up yet, but I'm thinking that people will go onto the exchange, punch in what their income is, where they live, the type of coverage they're interested in, and the exchange will pull up the plans that are available so they can compare them.
So farmers or everyone will have to make a decision between October 1 and January 1 for that individual aspect. They'll need to make a decision on what they want to purchase, and that will have to be in place by January 1.
Individuals will have to, including farmers, if any individual will have to decide what they want to do for coverage. So as a business owner, you'll have to decide, do I want to provide coverage for my employees and for myself through an employer-sponsored type of program, or do I want to go on the exchange and purchase an individual policy and leave my employees on their own to get whatever it is that they might want to have? Yeah, the question is, at the federal level, there has been talk about delaying this, the individual mandate for a year, or actually delaying funding the entire project. There is always talk about that, and there's been talk about this since 2010, just not funding it. I have not seen or heard anything that's actually going to take effect. I'm not saying that it won't. I was surprised when the employer mandate was delayed. It's very possible. I mean, when I look at where we're at right now and with these exchanges supposing to be operational October 1st, I have my doubts. I mean, I don't know that they're really there yet, but I don't know. I haven't seen anything that strongly suggests that is actually going to be delayed. And we're really far into it right now, so I'm just not sure. Yes?
During your presentation, you talked about, I think you referred to it as a broker, who we get our insurance through.
Yes.
Was that the term you used?
Yes, broker that might, when I refer to broker, I'm talking about whoever you're working with to purchase your insurance. And if you go directly to the insurance agent, I'm not sure, insurance company, whoever you're working with there would be your broker.
Okay. I have some problems, and I don't know, is there some other place we can go? Because I'm pretty sure I know more about it than he does. And I don't know anything about it.
Okay. The question is, the broker maybe doesn't know a lot about this, and is there some other place? I mean, you know, I don't know what resources you have available here, but...
We have Farm Bureau insurance agents that handle group coverage. If you're not happy with the person you're working with, you could change agents or seek out another agent. I really don't have advice on who to use, but there are agents available for that.
So the answer there is...
Other companies as well.
The answer there is going to other agents, or you could always seek the help from a lawyer. You know, you could get counsel if you have, you know, more confusing questions and need help on complying with the law, or, you know, different questions like that.
And Nancy, you work with a variety of brokers that if somebody wanted to ask you for...
Absolutely. I do work with a number of different companies that sell health insurance or work with companies to get benefits in place. So I can always give referrals as well.
Including Farm Bureau.
Including Farm Bureau, of course. Any other questions?
I'm going to put you on the spot a little bit.
Okay.
Do you think that we could pull up the DOL example for the employer notification, and maybe it's the one where they're not going to provide, and see if there are any questions on that, just so that if people are home and they pull up that example and they say, I have no idea what this means after listening to the presentation.
Sure.
Would that be all right?
Sure.
Okay.
While he's doing that, can we talk about what an employee is again? So I'm thinking of a typical farm that has a mixture of full-time employees, seasonal employees, all age employees. So I'm thinking you have to add up every hour of every person, right, that you employ throughout the year. And then out of that, do you get at least 50 times 30 hours?
Yeah, the question is when you're looking at what your employees are, this is for looking at whether or not you're required to offer coverage.
That's right.
And that requirement is if you have 50 or more full-time employees. And for that purpose, you're counting part-time equivalent hours. So you're looking at the past 12-month period and essentially counting, if you have, 20 or 50 or however many full-time employees per month, let's say 20 because you're under the 50, I actually chart this out when I've done this for employers. So I have my 12 months with 20 full-time, and then for my part-time, you're counting up all the hours for your part-time, seasonal, whatever they may be, and adding up their hours and then dividing by the number of employees, so you come with like the average hour. And then you add the full-time plus those part-time equivalent hours together throughout the 12-month period to determine whether you employ, on average, more than 50 employees per month, I'm sorry.
At 30 hours per week.
Yes, at 30 hours per week. Now, there is special rules for seasonal employees, temporary rules right now, where if you have employees who work seasonally for under 120, essentially 3 months or 120 days per year, if that limited period of time when you're having your seasonal employees work for you, if it causes you to go over the 50 employees just for that limited period of time, for less than 3 months, you don't have to include those 3 months. You don't have to include those seasonal employees, I'm sorry, for looking at that limited period of time. And if you have questions on that, I can help you kind of work through that.
Yeah, just go through that seasonal employee exemption.
Okay, so when you're adding up your employee hours for each month throughout the year, if you have a period of 3 months or shorter where you exceed 50 employees because you have your seasonal employees during that 3-month period,
Right.
you don't have to count your seasonal employees those three months. So it's only if you have a short period of time where you're exceeding 50 because of your seasonal employees.
Nancy, this is gonna maybe be easier if we could chart it out, but I've had a question where I had a grower that had asparagus, and so there were some workers that took them over the 50 count for a month in the spring, but then it was different workers that came in later in the year. Is it employee specific, or is it just total number?
The question is it employee specific when you're looking at that seasonal exemption, or is it total employee number? And it's just total employee number. It doesn't have to be 3 consecutive months. It can be different months throughout the year. So if you have different employees and you're over that 50 threshold for 3 different months throughout the year, that seasonal exemption would still apply.
This is for 2015.
This is for 2015, yes, but you're going to be counting in 2014 to determine whether or not you're subject to the law in 2015.
Do entities matter? If you have a company that you've established to do asparagus, and maybe a company to pick cherries and a company to pick apples, and you have ownership in those 3 companies, but they're separate entities, does that matter?
Question is, if you have ownership interests in separate entities, does that matter? And the answer is yes, it absolutely does matter. If you have common ownership in separate entities, at a certain specified threshold, making you part of the same what's called a controlled group under the Internal Revenue Code, you are considered as one employer. So you have to count the employees from each entity to see whether or not you're over that 50 employee threshold.
What if suddenly all my employees become independent contractors?
What if suddenly all my employees become independent contractors? The government doesn't look very fondly on that. Let me just say, what the government looks at is whether or not the people are truly independent contractors. So calling somebody an independent contractor does not make them an independent contractor. If they're truly an independent contractor, you don't have to provide them coverage. If they're truly your employee under the common law standard, they're coming to work for you every day, you're telling them what to do, you're telling them what hours they have to work, they're your employee even if you call them an independent contractor.
Where's the bill plan defined
Nancy, I'll add into that.
Okay.
This hits home when we start talking about independent contractor versus employee. That's exactly what my family farm's 10-year class action lawsuit was all about. And it was about a different thing at a different time. And the workers wanted it that way, all those kinds of things. We had all those kinds of justifications. It is not worth all the headaches you're going to get, not just in the healthcare area, but the labor employment area as well if we try to switch that. So. Creative thinking, though, I like that.
Any other questions? Great, thank you very much.
Did you want to
Oh,
go
I'm
through
so
that?
sorry. Yes, I do.
Ryan did all
Well, I might not want to, but let's see here. So here's the general information, and this is just asking these various questions. Do you want me to go through that, or just get down to where they need to actually
Just
fill
go
things out?
To fill it out.
Okay.
And as a reminder, this is just a model. You can create your own, but this is a DOL's model.
This is a model from the government, and as I said before, it's a little bit wordy. It repeats things several times, so that's why companies such as the Michigan Farm Bureau have prepared different models to kind of consolidate things and make them a little bit more concise.
Yeah, this is the notification.
This is the notification, yep, the model here. Let's see here, I think I have got a pointer here, but I'm not sure, let's see. Okay, so employer name, that's pretty self-explanatory, your employer tax identification number, so all the employer identifying information, who we can contact, so you're going to need to have a contact person at the company that the government can call if they have questions. So there's that. And that's all you have to fill out when you don't provide coverage.
And above, right there is where it has the information on, that's the notification. That last paragraph would be the notification for the healthcare exchange, correct?
Yes, down here is the address you go to for more information. Now, if you provide coverage, the notice is a little bit lengthier than this and asks some more questions. Is your coverage affordable? Does it meet minimum value? And that's some of the things we've talked about. Hopefully your broker can help you. If they can't, hopefully, we can help you with that as well. So, again, there's a little bit more information you do have to complete. If you pull up the government forms, you will notice on the form involving employers that provide coverage, there's a whole additional optional section asking you to provide specific information. You want to pull that up? About coverage options. You don't have to include that information. In my opinion, don't include it because I don't think you should be providing more than you have to. And in the event that, I don't know, something is wrong, I just would hate to see somebody on the hook for providing something that's not right. So here's where you have, do you provide coverage? You put down all employees. Probably most employers say just some employees. Do you offer coverage to dependents? And then here's that minimum value question. If you check this box, it means your plan offers a minimum value and the cost is intended to be affordable. So in my model notice, I've included this information, but then you get down to this. I've taken all this out, and this is what I would suggest not answering. Any of this is not required, and I think it just puts you more on the hook of making sure that your information is correct and doesn't change and things like that.
Which ones are not required?
Well, the third page, entirely get rid of that page right there, and keep the second page and the first page if you're going to use the government model. Yes?
We have an employee that declined insurance. I guess I was under the impression we had to offer insurance to everybody equally. How does that work?
The question, are you asking about a person who declined coverage when you offered it to them? As an employer in 2015, your obligation is to offer coverage to your full-time employees. It's up to your employees whether or not they want to take the coverage. It's the same thing as it works right now. If they decide not to take your coverage, they have the option to do that. If they go and purchase coverage on the exchange, they have the option to do that. Even if they go purchase coverage on the exchange, that doesn't impact you as an employer because you've fulfilled your obligation of offering the coverage.
Do we need something in writing, turning it down?
Question is, do you need something in writing turning it down? I would suggest getting something in writing going forward because of these new employer penalties that are potentially out there. Yes?
I had someone ask me yesterday, and I don't work in the group coverage, and I didn't advise on it, but
I had an employer group that said, I'm gonna continue to offer coverage to my employees that I have employed right now. But any new employee, I'm not offering them health care coverage anymore. Should they be doing that, or is that okay?
The question is, can you set up a plan where you continue providing coverage to anybody who's currently employed, but any new employee you will not provide coverage to? As an employer, you can set your eligibility requirements so you can set that rule. However, come 2015, if you're a large employer and you're not offering coverage to all your full-time employees, you're going to be subject to a penalty potentially. So there's that. A small employer could do that. I will also tell you that at some point in the future, there is going to be non-discrimination rules that take effect for insured health plans. That's part of the Affordable Care Act, but the effective date is not known yet. But at some point, there's going to be some sort of non-discrimination testing, meaning that you can't provide coverage just to your higher paid employees and not your lower paid employees. Great, thank you.
Thank you, Nancy. You made it all sound so simple. If I didn't introduce myself before, my name is Marybeth Birchmeier, and I am the manager of the Health Services Department here at Michigan Farm Bureau. As we just heard Nancy give all the legal details of what is going on with healthcare, a lot of you still have questions on the individual side. And in my department, we work with the individual coverage for Michigan Farm Bureau members. So I just wanted to give you a little bit more additional information of what solutions Michigan Farm Bureau is working with to help you as a farmer and as a participant with the Michigan Farm Bureau members. So just to give you a little more information as far as individual coverage, we have been diligently learning all of this information as well, and we want to help you with your coverage for yourself as an individual. We have been trained as far as in the Health Services Department. We are learning every day more and more about this, and our agents were trained on Monday in regards to the marketplace exchange. And so if you have questions, you can call the Health Services Department or your agent in regards to your individual coverage. And I'm going to give you a little more detail of where you need to go, for instance, depending on which product you may be enrolled in right now. So the first thing I wanted to tell you, as Nancy said, is that the rates aren't available yet, and the exchange or marketplace, kind of use that name in conjunction with each other. It's not open yet, so there's not a lot you can do today to be proactive, but on October 1st, it's this magical day. We'll see what's out there. We actually have been informed of what the benefits are going to be on the exchange, and again, our agents have been trained on that, and our health services staff. So we've been working in conjunction with Blue Cross Blue Shield of Michigan since 1941, and we are still continuing to do that. And we're going to give you the information in regards to how it relates with Blue Cross Blue Shield. One of your biggest questions is, am I eligible for a subsidy? How do I know? There are all kinds of calculators out there, and they're pretty simple. We will be providing on our website a link that will get you to give you that information, and so you can take that simple step to see, do I want to buy on the marketplace? And should I? If I buy on the marketplace, I'm eligible for a subsidy. So we'll get a link for you up on our website in the next couple weeks for the calculator to tell you if you even have a concern of what you need to do right away, and are you eligible for the subsidy. So I think that's important for you to know. If you are currently enrolled in our Blue Cross Blue Shield member individual products, there's a few different ones, so I want to explain how those are different and when the obligations are for you to maybe change your coverage and to make some decisions in the individual business. If you have our Forever Life product, which is administered by Blue Cross Blue Shield and underwritten through Forever Life. If you have the individual coverage through our Health Services Department, we actually have an extension on that one because it kind of acts as group coverage. So we have an extension to continue those benefits as is until August of next year. So in the next couple weeks, you'll be getting a letter from Blue Cross about your Forever Life, and it'll say you don't have to make a change right now. You can keep your coverage. However, that notice is to notify you that you may be eligible for a subsidy and you may want to shop on the marketplace, and you can make a change. That is an option for you. But a lot of people are relieved to know that they can stay in that product through August, and you'll get additional information on that in the next couple weeks before October 1st. If you currently have a My Blue Cross Blue Shield product with maybe through a Farm Bureau agent, you'll also be getting a letter in the next couple weeks. That letter is going to tell you that you need to make a decision. The products that are currently out there aren't compliant with these new ACA laws. So on January 1st, you will need to have made a decision and made a change in your healthcare product. Again, some of these decisions, there's a lot of information as you saw. You may need some help, and we want to help provide you with some assistance, and that can be through your Farm Bureau agent, and we're also going to have a specialist or two, depending on how it all works out. We're going to have knowledgeable people in our Health Services Department that can assist you. So don't feel like you're alone in this. We're gonna help you. Yes?
I'm sorry, are you talking about individual policies or group policies?
I'm talking about individual right now.
So, okay, are you gonna address group stuff too?
For the group, you would go through your agent, and I know you had some questions about your agent, so we can talk about maybe assisting you and getting some assistance, okay? Okay. If you're in our Blue Care Network product with Michigan Farm Bureau, that product also, you will need to make a change January 1st, and you'll get a letter stating that you need to do that from Blue Cross Blue Shield, and the Health Services Department will assist you in making those changes, or your agent. In addition to the Farm Bureau agents, the Health Services Department will be accessible. As we already said, the marketplace isn't open yet, so we can't give you the information. We have seen the product design and whatnot, but that will all come out October 1st. Not advising everyone to call our lines on October 1st because it's going to be kind of maybe a crazy day, but just relax. You have a little bit of time here to make some decisions, but I think it's really important for you to just take your time, get some advice from your agent. The agents that are going to be continuing selling the products should be well informed, and again, our Health Services Department should be able to help you through this tough, big, major change that we have going on. So we know it's not an easy thing, but we want to be here for you, and keep looking at our website and give us a call if you have questions. Contact your agent, and we'll assist you through these changes. Questions? Yes?
Does everybody that's in one of these plans have to do something?
In the My Blue and the Blue Care Network, yes. The Forever Life, the answer is yes, but not until August. So if you're in an individual plan, yes.
The first two, they have to do something by January 1, but the third one?
Yes. And actually, the cutoff date for a January 1 effective date, I think your enrollment has to be in before December 15th, Sylvia. So.
But the Forever Life customers have till August?
The Forever Life customers have until August. Other questions? Did you think of anything to add, Nancy?
Maybe not.
Okay. I want to thank everybody for participating, and this is only the beginning steps of informing you. As we get more information and as our website gets beefed up and we'll get information out to you through the Michigan Farm News. Our Health Services Department here for you, and your agents as well. So thank you very much.